Good day, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH Core. It's my pleasure to welcome you today to our first CAQH Core National Town Hall webinar of 2016. Hope everybody had a Happy New Year. Before we begin our session, I would like to mention a few logistical items. You can download a copy of today's presentation from the CAQH.org website. To do so, navigate to the Core pull-down menu at the top of the CAQH.org welcome screen and select the Core Education Events page. A link to the PDF version of the presentation can be found under the listing for today's webinar. On this slide, you can see a screenshot of the attendee GoToWebinar dashboard. You should see something that looks similar to this on the right-hand side of your computer desktop. When joining today's session, it's possible you may have joined the audio portion of the webinar using your computer speakers by default. If possible, we would prefer for you to join the webinar audio by telephone. To do this, please select the telephone audio button in the audio panel of your dashboard, and the dial-in information will be displayed. Make sure you enter your audio PIN, which is found under your dial-in information. We will save time at the end of today's program dedicated to responding to audience questions. You're encouraged to submit your question at any time during this webinar by typing them into the questions panel on your dashboard. We ask that when you submit your question, you please identify your type of organization so that we can give you a more accurate response. So today we'll start off with a high-level CAQH Core strategic update, followed by a presentation on our most recent CAQH Core Phase 4 operating rules. We'll continue with a summary of our work to maintain the EFT and ERA operating rules. After that, we'll share some information about the Voluntary Core Certification Program, and then we will conclude with an overview of upcoming education and outreach webinars and new educational tools that we are in the process of developing. We'll have plenty of time at the end of the session to take and answer all of your questions, and we also will have some time at the end of the session to do an open mic discussion. And now I'd like to introduce our first speaker, CAQH Core Managing Director, Gwendolyn Lowe's. Gwen?
Great, thanks Jessica, and Happy New Year to everyone. Thanks for joining us today. I know everyone's busy getting back into the office and getting back into your roles. So we're hoping, as you all know, 2016 is going to be a very interesting year for CORE as it moves from its work really focused on mandated activities through the Healthcare Reform Bill, ACA, and going more through into the voluntary process. And so I wanted to share some of the things that the CORE board has been talking about over the last several months and throughout 2015. And just as a reminder, the CORE board is multi-stakeholder. It's an equal representation of health plans and providers. There's also vendors on the board and advisors. And it's very much represents the multi-stakeholder aspects that are in the CORE participants, and obviously is constantly taking consideration the industry at large. So the board did work to revisit the CORE mission and vision, and after multiple interviews and discussions, they feel that it still stands strong and true. And we just reminded people about what the mission and vision is. You can see from the mission, the creation and adoption of the operating rules to accelerate interoperability and line administrative and clinical work. And the vision for what CORE is and as an industry-wide facilitator. The board definitely feels our job is not done. We've made a good start, we're in a good place, but we have more to do as an effort and also as an industry and the ecosystem at large that CORE sits in. If we think about where we're going moving forward, there's a commitment, no doubt, to the mission, vision, and the integrated model. And when I talk about the integrated model, it's the rule writing, the maintenance, the education, the certification, and all the tracking that goes on around it. So we as an organization, and you as all the companies and individuals that make up the efforts of CORE, because without you there is no CORE, that all those components are essential. and we really do play a unique role. But we began as a voluntary effort, and we're going to be moving forward both emphasizing our voluntary role and then also our HHS role. And if you think about when CORE began, for some of you, just a little history lesson here, there was no ACA, which I think everyone is probably hard to imagine in a time when ACA did not exist. But CORE really did begin with a number of multi-stakeholders sitting at the table with the need for operating rules. And so the board no doubt believes that that stands true. So you'll see in 2016, we're going to continue up on the top our role for the ACA work. That means innovative maintenance and tracking of existing rules. And many of you are involved in those efforts, and you're going to hear about them today. And we can continue to improve on that. We want to hear about how you think we should improve. And then supporting the rollout of the rules that do exist, especially the Phase 4 rules, which were just finalized, and studying the ROI. We need to do more work on that. There is the voluntary attachment pilot, which we are going to launch this year now that we're done with Phase 4. There's participants who now have the time to participate, and we also have staff to be able to support the effort. And then working with the ACA Review Committee. If you all have not learned about the ACA Review Committee, we have testified to it. It was a committee that the Congress felt was essential to see the status of the operating rules, the code sets, and the standards. And NCVHS is playing in that role, and there's a link if you want to learn more. And then to really achieve the full savings of the transactions, we really are going to be working moving forward on how do we drive more adoption and create this ongoing industry model to develop, adopt, and do the maintenance. So as an industry, how do we see a long-term vision of development, evolution, adoption, and maintenance and improvement? And then is there voluntary enforcement and compliance as part of that? You know, CORE certification is voluntary, and it has a voluntary enforcement mechanism. How do we all work together as an industry, all of you, to say we don't need to get, just rely on the government to look at compliance, but look upon each other like other industries do to ensure we're taking the best of all of this and making the benefits. So driving CORE certification will be a big goal this year, because it does support adoption and helps trading partners on educating themselves about the benefits they should be taking advantage of. Then future models, the whole payment model is changing. That means workflows are going to change, transactions that support the workflows will change, and as CORE, partnerships will be essential to us as this change occurs. So we'll be not only looking at how you could potentially in the future extend the voluntary operating rules. A lot of you have lots of good ideas that are already cataloged in documented about how to do that, and we've shared them in testimony, for instance, to that ACA Review Committee on eligibility or claim status. But then what are the new areas for operating rules beyond those that we already cover? So with all that said, anything that we do moving forward, more voluntary operating rules with the existing transactions or new operating rules around some of the value-based care, will always be emphasizing strong evaluation criteria. You know, what's our goal? What is the ROI? What's the timing? Are there other players in the market? We do not want to do anything, and it's in our guiding principles that we do not repeat the work of others. There's much more to do than doing repetition. And then our strategic fit needs to be in the guiding principles. So if you, for instance, link on what you can see on slide 7 with the NCVHS testimony, that's the ACA Review Committee about the bigger picture, and we did lay out some things within eligibility on the content that we could add. So take a look at that and think about what do you think are the major priorities for moving forward in a voluntary basis. With regard to value-based care, the board really has, after much discussion, felt that an emphasis on fee-for-service as well as value-based is essential. I think we've all seen Medicare's dates about when they, as an organization, and they are one of the very biggest payers that almost every provider in America works with will be switching to value-based care, and it's really going to change the market. Many of the private payers out in the market are already rolling out programs. Provider organizations, health systems are launching their own health plans that are quality-based payment models. So the world is drastically changing and will continue to do so. So in 2005, the board did an initial assessment of the need for value-based payment and the data exchange role in that. They did identify some opportunities within that assessment, and we have a summary we can share with you all. So in Q1, they're going to take that summary, and there'll be subject matter experts will be interviewed on the needs and the gaps in value-based care for data exchange. A white paper will be issued, and the core participating organizations, and we obviously will seek broader industry engagement, will need to prioritize any potential value-based initiative that core will do and consider its alignment with ongoing fee-for-service needs that we may want to add to the core catalog of rules and the maintenance process that goes for any of those rules. With that all said, as we look at the work ahead and we think about what do we as an industry want to do, you as providers, the vendors, the payers that are all on the call, those that support them that are on the call, whether you're consultants or associations, we all are seeking a model that has interoperability in a secure framework. You've got the data readily at your hands and you're trusting your trading partners. We are supporting, as part of that, this ongoing work that the federal government's doing, but we need to go beyond that and think about what we want to do on a voluntary basis. You all know there's already 2 sets of operating rules that are mandated, and everyone should be conducting these transactions using these operating rules for their eligibility, claim status, EFT, and ERA. We know there's some people that are still in the process of adopting, so we're going to continue the education on that, but it's really set a groundwork for we as an industry expect to be able to track whether it's batch turnaround time, system availability, real time, a whole infrastructure that we can track all our transactions and the content in them. We'll be awaiting any news from HHS on the health plan certification mandate. And as some of you may have heard, there's a uniform agenda that HHS issues, and they did say they were going to issue a new proposed rule on health plan certification in April. We will keep you apprised of that. And like with when any regulation comes out that's related to core activity, like HPID you saw this year, we will hold a public call. We will have comments. We will get the comments back. We will issue another call and review and put out a draft model letter and have a lot of debate, appropriate debate within that process. So we'll be awaiting that. That's in the April timeframe. And then for the phase 4 rules, we'll be driving, like we did with the earlier rules, voluntary adoption. And then you'll hear later from Erin Richter some of the NCVHS work that will move forward. But we really do have a movement from the government and regulation to continue operating rules and alignment with standards and the code sets and the maintenance, paired with what we as an industry want to do on a voluntary basis. So it's a very exciting time because we have both of those things at the table, and how do we continue to align them, but also then align some of the work within the administrative and the clinical as the value-based payment piece rolls out. So that's the strategic overview, and I am going to hand it over to Erin and Bob to go through some of the phase 4 operating rules.
Great, thanks, Gwen. And what we would like to do is really make sure that you have a good understanding of the scope and the impact of the phase 4 operating rules. So just as Gwen mentioned, we are building through and working from our mission. On the next slide, you'll see that we actually have a New Year's resolution for the group. And we resolve as CORE to work with the industry to provide the most comprehensive resources and tools that can directly assist your organization in implementing the phase 4 operating rule set. So the scope of the rules found on the next slide, just as Gwen mentioned, it really focuses in on a set of infrastructure requirements to ensure that for the 4 transactions covered in Phase 4 of the prior authorization, the claim, all 3 varieties, the professional, institutional, and dental, the enrollment, disenrollment transaction, and the premium payment transaction, those 4 transactions all now have a specific set of infrastructure requirements that are to be met in Phase 4. And the requirements include how the transaction is conducted, either in real-time or batch, different types of response time requirements for batch or real-time, as well as acknowledgments if you're conducting the transaction in batch or real-time, and a uniform safe harbor connectivity and security for all 4 transactions. Similar to what we have in Phase 1, 2, and 3, this connectivity allows the industry to really build a network to ensure that the transactions can be conducted from any entity to any other entity in the same way. Very consistent in helping drive down some and reduce costs for setting up connectivity and security. We also have infrastructure requirements around system availability and companion guide templates. Some of the transactions have other specific transaction infrastructure requirements as well. So it'll be important to ensure that if you do conduct those transactions, have a thorough understanding of what each of the individual requirements are. And shortly, Aaron will go over some tools that we have that can help you ensure that you understand all of the implications of the requirements themselves. On the next slide, we walk through the actual impact of the Phase 4 operating rule set. Again, focusing on the 4 transactions, the key components, as I mentioned, is the safe harbor connectivity to ensure that all entities are submitting and conducting the transactions electronically. A minimum amount of time for system availability, so the system that you're trying to conduct the transaction with will always be up and available when you expect it to be up and available. Also, as Gwen mentioned as well, the acknowledgement, to making sure that you can track the transactions any point along their pathway when you transmit the claim or request an authorization. You know exactly where it's at and where it's going along that pathway. Required response times are going to be very important as well, both for real-time and batch, so that you know when to expect the response and when the response will be made available to you. And last but not least, a common format for the companion guides so that as you are implementing the connectivity for the transactions, you know exactly what to expect and where to expect it to find the information you need to remediate your systems, to set up that connectivity, and to conduct testing with your trading partners. So the key impacts based in Phase 4 and what we would like to see the industry move towards, there's a whole list here, and I won't go through each of them individually, but to highlight some of the most important ones is to identify those key gaps and barriers at any point in the transaction so that the transaction can flow automatically from point A to point B, from the submitter to the health plan and back to the submitter. All of this will make the system much more efficient and reduce administrative cost. Because anything that we can do to automate and turn these transactions on, increase their usage, will make it much cheaper for both the providers and the health plans in conducting these business transactions. With that, I'd like to hand the call over to Aaron, who will walk through some of the key support tools and our next steps.
Thanks, Bob. We are excited to announce that we have a number of tools coming out to assist you with your implementation of the Phase 4 operating rules over the next several months. The first tool I want to talk about was made available in early December. Many of you may already be familiar with the format of the Core Analysis and Planning Guide. We created analysis and planning guides for the previous phases of the Core operating rules, and this new guide is specific to Phase 4. This guide will help you understand the applicability of the rule requirements to your organization's systems, help you identify which systems, both external and internal, might be impacted by the operating rules, and allow you to conduct a detailed requirement gap analysis to find out which systems may require remediation and which business processes may be impacted. The guide includes 3 tools which folks have found really helpful to complete your analysis and planning. The first is a stakeholder and business type evaluation. The second is a system inventory and impact assessment worksheet. And the third is the gap analysis worksheet, which lays out line by line each of the requirements in the Phase 4 operating rules for you to consider which systems are impacted by them and what updates and adjustments you may need to make. On the next slide, the next set of tools that will come forward for Phase 4 will be a set of Phase 4 frequently asked questions. Many of you are familiar with our frequently asked questions, which are currently available for Phases 1 through 3. We anticipate releasing between 150 and 200 Phase 4 FAQs over the next month or so. In other really great news, we have been working to revamp our FAQ website to make it searchable, and the FAQs will now be web-based, so no more PDFs to scroll through. This new format will help you to more quickly find your answers. You'll be able to search only the FAQs for keywords and view in one place all of the FAQs available for a given operating rule. So we are very excited about offering that tool to you in the next month or so. Now I want to talk a little bit about the next steps for the Phase 4 operating rules. At CAQH Core, we have completed our process for approving the rules for voluntary implementation, and the next steps really lie with the regulatory process. We already updated NCVHS on the status of the Phase 4 operating rules in an earlier hearing and with a letter. In February next month, we will be testifying before the NCVHS Review Committee on the Phase 4 operating rules. And then as appropriate, NCVHS could make a recommendation to the Secretary of Health and Human Services regarding adoption. As a next step, HHS may then publish a regulation in the Federal Register once it determines what is appropriate for federal mandate. A public comment period with 60 days or more would then follow the publication of any regulation, whereby entities such as yourselves can submit comments on the regulation to CMS or HHS. Based on the public comments to the regulation, the industry will then be required to implement any mandated operating rules, typically within 2 years of publication of the final regulation. So if you do the math, there's a couple-year time period before any implementation date might come forward from the federal government. That said, it never hurts to get a head start. If you do have thoughts or comments about the Phase 4 operating rules, there are opportunities both within NCVHS and within the regulatory process to make your comments heard. Bob mentioned CAQH's New Year's resolution to provide you all with the tools to implement the Phase 4 operating rules. Your New Year's resolution, we recommend, is to get a head start on these rules. Become an early adopter of the Phase 4 operating rules so that you're ready to go when these regulations do come forward. Like we said, we'll have many tools, FAQs, the analysis and planning guide, and even more tools available in the coming months on our website. So now I'll turn it over to Drew for our first polling question.
Great. Thank you so much, Erin. And this now brings us to our first polling question of the webinar. And I will read it, and then I will launch the poll, and we will pause for a few brief seconds for you to log your answer. And our first poll is, do you plan, or does your organization plan to voluntarily implement the Phase 4 CAQH Core operating rules in 2016? And I will launch the poll, and we will pause here for you to respond. We'll take about 20 seconds. Take about 5 more seconds. Okay. I'll close the poll and share the results. And it seems the largest percentage, 48%, was not sure, followed by 21% at yes, and 16% at no. We're hoping that these education practices and sessions that we have throughout the year will maybe help clear up some of that understanding.
I think it's really one thing we want to consider, Mrs. Gwen, is obviously with or without regulation, and maybe these operating rules are not regulated. We as an industry do conduct, there are health plans on this call, there's vendors, there's providers, there's clearinghouses. You're all exchanging these transactions and getting some of these basic ecosystem pieces down so we can track when transactions do get lost, when we can improve our timing as a group and as a collaborative is really important. So as we're continuing to look at what do we as an industry want, even on a voluntary basis, you should think about what do you as an organization with your trading partners or those that you contract with expect from these transactions, and look at the phase 4 rules. We have had a number of entities come to us to say some of them will be a challenge, but it's allowing them to relook at how they work with their vendors or how their internal systems work. So think about that process improvement and that business flow as you're moving forward.
Great, thank you, Gwen. And so we'll continue with today's program with another joint presentation on the CAQH core operating rule maintenance activities from Erin and Bob. Go ahead.
Thanks, Drew. In continuing with our New Year's resolution theme with this presentation, we have another resolution at CAQH at CORE for 2016, and that is to maintain the current operating rules, specifically including the core code combinations, and to work with the industry to develop a continuous maintenance process that meets and evolves with industry needs. On the next slide, several of the operating rules, particularly in phase 3, recognize that as the industry evolves and changes, there may be reasons to update or add additions to the existing operating rules, or even remove things from the existing operating rules. CAQH Core has several task groups that manage these operating rules. These task groups encourage full industry input through review and analysis using real data from key stakeholders to inform the process. They have open and relevant discussions. They complete endless amounts of straw polls and have final approvals over any maintenance to these operating rules. Specifically, there are 2 task groups that are meeting currently to maintain the core EFT and ERA operating rules, and that includes the CAQH core code combinations task group, which oversees the core code combinations included in the uniform use of CARCs and RARCs rule, and also the enrollment data task group, which maintains the EFT and ERA enrollment data sets, which are included in the EFT and ERA enrollment data rules. I'm going to give a quick update on the 2015 work of the enrollment data task group, and then I'm going to turn it over to Bob to talk about the status of the core code combination. The enrollment data task group met this past fall to conduct its 2nd annual review of the core required maximum EFT and ERA enrollment data sets. During the 2015 review, the task group considered whether or not to conduct a comprehensive review, which it was scheduled to do. A comprehensive review for this group would include making substantive and non-substantive adjustments to the enrollment data sets. Substantive adjustments would require HIPAA-covered entities to update their enrollment forms and systems within a specified time period to continue to be in conformance with these rules. The task group considered some rationale around whether or not to make these updates, such as other industry initiatives, industry resources, and as a result, the task group decided not to make any updates to the enrollment data sets in 2015. Therefore, HIPAA-covered entities are not required to update their enrollment forms or systems this year. The task group will reconvene in 2016 to determine whether any adjustments are needed at that time. So if you're interested in joining this group, you can always email us at core@caqh.org. I'll now turn it over to Bob to talk about the code combinations.
Great, thank you, Erin. And just as Erin mentioned, the Core Code Combinations Task Group does meet just about every month, where we actually do a couple of different things. Now, the goal of this task group is to bring uniformity to the claim adjustment code sets through an ongoing data-driven focus and process. It is a lively group. We have our own dedicated webpage for the entire process. There are over 40 core participating organizations that make up the group today that are led by 4 stakeholders. And these include stakeholders from national health plans, a large vendor, as well as a provider organization. So we make sure that it is a multi-stakeholder approach when we review the different code combinations. The group, this task group, conducts 3 compliance-based reviews, or CBRs, and 1 industry-driven market-based review, or MBR, every year. We have been active since 2011 in developing processes to address both the compliance-based and the market-based reviews. So they have a lot of energy to work on the code combinations and a lot of effort. And we're actually working on a current compliance-based review because the code sets were just published on November 1st. So they're working through the last few edits and changes, revisions to the edits to the code combinations, and we'll publish that on February 1st in just a couple of weeks. So be prepared to make adjustments and changes because the new core code combinations will be published on that February 1st date. Also, concurrently, we've launched the market-based review on December 10th. This is where the entire market, the entire industry, anyone that practically can hear my voice right now, has the opportunity to submit adjustments to the core code combinations. And so this is very important. On the next page, we kind of go into a little more detail on exactly what the scope of the 2015 market-based review is. So to submit, these are specific changes to the existing core code combinations. You can submit additions, removals, and relocations. And just an example, if you wish to make an addition, you can add a RARC to an existing CARC or to a group code. You can remove a group code from an existing RARC. Any possible type of change to the existing core code combinations can be submitted through the market-based review. So if you are a health plan and you're having particular problems with a specific code combination, your providers keep complaining about it, or because they can't understand the actual definitions between the CARCs and the RARCs, they're not aligning very well. Now's your opportunity to make adjustments to the core code combinations to request to have that removed. Or if you need new ones because you have new business services or new types of policies and plans and your providers are stumbling over the changes, you can have requests to have additions added to the core code combinations. So all of that is open and available now. And on the next slide, we'll kind of walk through some of the details to make sure that any eligible submitter, which is all core participants plus non-core participants, that create, use, or transmit HIPAA-covered transactions. So if you're conducting the 835 and you have issues with the code combinations, now is the opportunity for you to make adjustments and have a submission into the task group so they can review those and make updates and changes. Again, since we launched that on December 10th, it is open for 60 days, so it's open until February 10th. So you still have over a month to make sure that you can get your submission in. You can use the link here in this PowerPoint, or you can also just visit our website, special one just for this task group, where you can also find the link to the MBR form. We will only accept submissions from the online MBR form, though, so it's very important that you use that form and that form only. Again, once you have completed your submission, the task group will start its next steps beginning in March through May of this year. The task group will review all of the submissions that have come in and make any potential adjustments, with a publication date in June of 2016 for any adjustments due to the market-based review. So you still have over a month to get your submission in, and then you can be part of that task group on the next slide, because we would hopefully, you'll take the New Year's resolution to, if you do have issues or problems with your core code combinations, how those combinations are being used in the industry. You need to add them, you need to remove them. you need to make some minor adjustments to them. We'd like to make sure that you're part of that process. So if you do wish to become part of that code maintenance process, visit our website and you can sign up and be part of that task group. Also resolved in being part on the ongoing maintenance process by submitting your adjustments to the MBR before February 10th. I think, Gwen, you got a question or comment?
I just wanted to put another plug in for this. Many of you are involved in attachments, for instance, and that again is going to be a focus for 2016. And I think many of these claim denials and adjustments are attachments. And if you think about how does data flow throughout the industry and what are the challenges and how do we make interoperability and connect things, ensuring the claim has what it needs on the claim form is essential piece, and we're going to need to study that more. And unless we have your data and your contribution, the industry can't prioritize which items, which attachments are more essential, which are causing more problems. And so this is one area that could help inform that. And I think we all know, people estimate it's like maybe 15% of the claims have challenges for the denials and the adjustments. So we know there's a lot of data out there, and we already have a lot now. We're going to continue to share that on an aggregated level throughout the year about what's driving this. But a lot of you out there can share more data, so we as an industry can make more informed decisions. So definitely get involved, and plus reduce your your bad debt if you're a provider out there by making this process more streamlined.
Great, thank you. And building on that, trying to work through any problem areas that you have when it comes to the remittance advice and the claims data. These are the types of the task groups really get down into the weeds and really look at those very specific issues and try to resolve them. So the more data that we have, the more coverage that we have, and the types of insurance products, the types of health plans, the types of vendors that are out there, those little niche markets that we may not have access to, those are the types of folks that we want also. Not just the large plans and large vendors, but those that have very specific needs and problems that you're solving in the market today. They can really help CORE solve some of the general problems when it comes to the data on the claims and the remittance advice. So thank you, Gwen. With that, I'll hand the call over to Matthew Albright, CORE Senior Manager.
Thank you, Bob, and Happy New Year, everyone. I'm going to talk to you for just a few slides about our plans this year in CORE certification. We've got a number of resolutions this year, and luckily for us, none of them involve exercise. First, we want to plan on making it easier for organizations to fill out and submit the necessary forms for CORE certification by offering the process online. We're going to continually improve our customer service and guidance we give to help you get certified. And of course, we're going to continue to present educational webinars with Jessica and Drew here that feature organizations that have successfully certified. So if you're thinking about certifying, I urge you to drop in on one of these webinars so you can get a sense of what you're in for, or look up one of our past webinars, which are available on our website for free. As a reminder, CORE certification is the gold standard for certifying conformance with the operating rules. What makes CORE certification unique is that the requirements for gaining CORE certification are defined by industry representatives for industry in a transparent manner. The best way to demonstrate that your systems are conformant is to meet the requirements that were developed by your industry, by your peers. CORE certification also benefits from a balance of powers involving 3 different stakeholders. While industry develops the requirements, the certification test is given by an independent third-party vendor authorized by CAQH CORE. After passing the certification test, your application goes through a robust review process with CAQH CORE, and it is CORE that approves your seal. Now, CORE certification is still voluntary. CORE certification has been proposed in a rule, but it is not, as of yet, mandated by the federal government. You see at the top of all these slides, we label this certification program as voluntary CORE certification. Although voluntary, CORE certification remains the best way to test your systems and test the systems of your vendors so that you benefit from all of the advantages of EDI. And those are advantages in terms of cost and especially in time savings. As of today, CORE has awarded 219 certification. So we'd like to congratulate all the health plans, the clearinghouses, and the vendors, vendor solutions and products that have gotten certified in 2015. And we'd especially like to congratulate all the state Medicaid plans and the California Medi-Cal plans that have become CORE certified this year. And they're fast on becoming CORE certified. There's a group of them fast becoming on their way to becoming CORE certified. At this moment, there are 10 state Medicaids or Medi-Cal plans that are either in testing, in review, or have pledged to certify. So I'm sure you've been reading about everyone's predictions for the upcoming year. Here's our prediction. 2016 will be the year of the Medicaids and the Medi-Cal plans for CORE certification. Also this year, the CORE authorized testing vendor Edifex is currently developing a testing platform that will test for Phase 4 CORE certification. Those are the rules that we just heard that Bob and Aaron summarize. We expect that that will be ready to be rolled out to the public in mid to late summer of this year. So take a look at the Certification Test Suite, which is available for free, again, on our website if you want to know what the requirements are for that Phase 4 certification. In the meantime, however, we will be testing the system this spring. If you want to be an early adopter of Phase 4 CORE operating rules and be among the first to be CORE certified in Phase 4, then come join us as a beta tester on the testing platform. Remember that CORE certification is not just for HIPAA-covered entities. Vendor products and solutions can be certified too, and we're looking for all categories of companies to be beta testers. If you're interested, contact us at the email there at the bottom of the page. So those are our plans and our resolutions for the year. How about you? You know, even if you don't think CORE certification is in your plans, you might want to ask your vendors or clearinghouses whether they are CORE certified, whether they can demonstrate conformance with federally mandated operating rules. We know there's a lot of questions out there about CORE certification and about the ACA mandated health plan certification program. Please feel free to give us a call, drop us an email. Even if you just have questions, we'd enjoy talking to you. I'll turn it back over to Drew, who has a poll question for y'all.
Great. Thank you very much, Matthew. And to piggyback on what Matthew was talking about, this brings us to our second polling question. And just like last time, I'll read it, and then I will launch the poll, and we'll pause for a brief moment. Does your organization plan to pursue voluntary CORE certification in 2016? And so I will launch the poll, and we will pause for a brief moment. We'll take about 7 more seconds. All right, we'll close the poll and I'll share the results. So the largest percent, 46%, was not sure. We do have many certification webinars and education sessions and resources on the website as well as planned throughout the year, so I hope those that answered not sure will take some time to join us. But Matthew, maybe you can make a point about this.
Well, I'd just like to say that I think it's great to see that 46% are not sure, but they're also attending this webinar. So I think that shows that there's some interest. And again, as I said before, if you've got any questions about what CORE certification is, how it fits into your organization, what the value might be to your organization, give us a call, send us an email. We do like to talk to people. We like to find out what's going on out there and what your sense is about where CORE certification fits or where the operating rule fits. So good to see that people are listening to the webinar.
Great. Thank you very much, Matthew. And so now, to give you an update on upcoming and new CAQH CORE education and outreach activities, I will be joined and presenting with CAQH Senior Manager Jessica Porras. Jessica, take us away.
Thanks, Drew. So on this slide, you can see one of our New Year's resolutions, which we actually plan to keep. And it's one of our overarching goals for 2016, which is to present information to you in ways that are innovative and varied in order to communicate our information in an effective and also a meaningful way to you. The next slide showcases our 2 upcoming January webinars. The first webinar is on the CAQH Core Phase 4 operating rules, and about a week later we will have a webinar on core certification with guest speakers from the Alabama Medicaid Agency. We really enjoy those implementer presentations since they're always chock full of lessons learned and best practices, so we hope that you'll join us on both of these webinars. And we will keep sharing future webinar information via listserv messages on social media and also on our website. So please keep coming back to us so you can see our upcoming programming. And the next slide will be taken by Drew.
Great. Thank you very much, Jessica. And Jessica spoke on about our upcoming webinars, and perhaps if you're not a stranger to CORE, CAQH CORE, you know that we do put out a lot of webinars and very successful programs that we enjoy providing to you, but we're also going to look at new products and new tools in our education arsenal. And one of those are going to be short informational videos, which we have begun creating, and you should be able to see those coming out and rolled out over the next month throughout this year. You will also be seeing e-learning modules, and these are to be used on your own. They are user-friendly, they're self-paced. Oh, and by the way, they're mobile-friendly too, so on the train home you can watch them on your mobile device. So we want to keep you informed in as many ways as possible, bringing you this information, and we want to diversify just how we bring that information to you. So we just wanted to make you aware of what's coming up this year, and we're pretty excited about it. And Jessica, I'll pass it back to you.
Thanks so much, Drew. And just on one point on that last slide is that you'll know when these new tools are available. We'll make sure that this information is communicated to you either by listserv or on an upcoming webinar. So on this slide, I want to encourage you to keep up with your resolutions or start some new ones. And I'm not talking about exercise or getting those closets organized, but resolutions to engage with CAQH Core. And how can you do that? Take a look at our website. Submit your stories, your ROI or adoption challenge stories. And you can do that by either calling us or emailing us. If you have any questions, you're wondering how to engage with us, contact us, again, by email or by phone. And continue to engage with us on our webinars and then our future educational tools. I think this is a back and forth information, and we look forward to continue to engage with you. And now we have some time for some Q&A. So what we were going to do is we're going to take a couple minutes for Q&A the way we've been doing it before, and I'll give you your instructions in a minute, and then we want to end up in an open mic discussion. So for this part of the webinar, please submit your questions by typing them into the questions panel of your dashboard. And again, like I said earlier today, please identify your stakeholder group so that we can better answer your questions. So the first question we have is a question for Bob. And the question is, are there any plans to expand the scope of the core code combinations beyond the 4 business scenarios?
That's a great question, and one that it's really important for the task group. The task group does have a process where they can review proposed or potential new business scenarios. They walked through this last fall and into the winter, early winter, that for all of the market-based submissions that they received last year, they decided not to move forward with. So this year, we're not accepting new submissions because there were nothing new that we've received over the last 2 years related to potential new business scenarios. Suffice to say, though, the process is in place that as the industry implements the existing 4 business scenarios, uses those through time, has metrics and trends, that the industry will have the ability to submit potential new business scenarios for the task group to review. We just don't have any this year for consideration. All of the ones that were submitted last year were kind of basically debunked through the review process by the task group. So no new ones for this year, but next year we'll have the process go in place to have the industry submit potential new business scenarios and go through that review process.
Thank you, Bob. The next question is for Matthew, and the question is there an update on the attestation option for certification?
Good. Thank you, Jessica. This is a good question, and I think this question, we're going to assume that this question is in reference to the proposed HIPAA credential, and that was an attestation-based option for the ACA mandated HHS health plan certification program that the Affordable Care Act mandated, but that we've only seen a proposed rule on so far. So if you all remember, CORE gathered industry together to look at that first proposed rule, and CORE was also tagged as the administrator of the HIPAA credential. That's that attestation that the questioner asked about. We pulled together industry, and industry examined the proposed rule and got together forms that could be used to apply for that attestation credential. And here's the long and short of it. We will not, those credential forms remain in draft form until we see a final rule from the feds on the ACA mandated HHS health plan certification. So we are not accepting at this point any attestation applications, any HIPAA credential applications for that attestation. And while we're in this category, let's talk more broadly about HHS health plan certification, the ACA mandated health plan certification. And I know we've also had some questions sent in about the HPID, which, as you all know, is probably tied in to this ACA mandated HHS health plan certification. So we've heard a little bit from the federal government. As Gwen referenced earlier, at this point, the best reference for what the feds are saying about that ACA mandated health plan certification comes from something called the Unified Agenda. Unified Agenda. And if you Google it, you'll probably get a link to it right away. And just a little note on the Unified Agenda. This came out in late November. It's a report that is released twice a year by the administrative branch that outlines the expected release dates of all of the federal agents' regulatory actions for the next year. So the Unified Agenda is not binding in terms of what it says about dates and when regulations will come out, but it's rather a best guess that the agencies are making and that's been cleared by the administration. So the Unified Agenda that came out in November lists the Certification of Compliance Program, that's the ACA mandated HHS health plan Certification of Compliance Program, and states that CMS is expecting to issue a new proposed rule for the program in April 2016. So I don't want to get anybody's hopes up, but I would say that says that there's an expectation that a regulation, a proposed regulation will be released, which will tell us more about the HHS health plan certification of compliance program as mandated by ACA. It'll tell us more whether the credential, that policy of, or that option of the HIPAA credential still exists, and it should give us more information about the HPID. Many of you probably participated in the CORE input session and the letter that was sent for the request for information on HPID this summer. There's a hope that this proposed rule that the Unified Agenda talks about will tell us a bit more about what's going on with all of those subjects.
And Matthew, this is Gwen. I would just add one reason why core certification is what it is today is it's about testing. You know, there is an interactive site. Entities do need to go in and perform tests and connect to the site and show in a simulated environment that they can meet the rules. And then they sign up and they have to voluntary enforcement so they can get contacted by other core certified entities or providers that they're meeting the rules. And right now, the core participants have felt that it's essential to have a testing environment, a executive level signatures, a voluntary enforcement process for core. And so we'll be continuing to have that because as an industry, we need to decide how are we going to promote the use and adoption of these transactions as well as, you know, enforcement among ourselves. So with or without that regulation, in which the credential was more of a signing on a piece of paper. We are behind the concept of the testing, the executive level signatures, and the voluntary enforcement.
Thank you so much, Gwen. So I think what we're going to do now is we're going to take some time to have an open mic discussion. And I'm going to share the instructions first and the topic of the discussion, and then we will be joined by my colleague, Aaron Weber, who will lead us through the conversation. So if you'd like to comment, you can raise your hand using the hand raise tool that's found on the dashboard. When it's your turn to ask a question, we'll unmute your line and you can begin to ask your question or make your comment. And once again, in order for you to be unmuted, you would have had to enter the audio pin on your telephone keyboard when you first called into the webinar. If you did not do so, we won't be able to patch you in. The topic we'd like your feedback on is on the screen, on the top of the slide. And the question is, what is your specific role and how can CAQH Core best serve your position or your organization in 2016? We'd like your feedback and ideas on what these new tools and approaches would be beneficial to you in 2016. So let's have Aaron join us and talk us through this while we await your comments.
Thanks, Jessica. So as Jessica said, we're looking to learn more about your New Year's resolutions related to operating rules and how we can best serve you. An example of what we might be looking for here is feedback from an EDI manager who's working to implement the Phase 4 connectivity rule that might find a tool or a summary of the major differences between the Phase 2 connectivity and the Phase 4 connectivity rules useful to assist with their implementation of that connectivity rule. So that's just an example of the kind of information. We'd love to hear back from you, and as a side note, we are working on that summary brief on the differences between the two connectivity rules, so that will be another tool coming forward in 2016.
Great. Thank you, Aaron. So we have someone who would like to join, Joe Steinert. Joe, let me see if I can patch you in here. I don't know where he went. Joe, I don't see where you went. See if you can raise your hand again.
Meanwhile, I think there was a question about dental and the involvement of medical and dental, and a few thoughts on that. One thing is on the dental piece, we absolutely, within some of the operating rules, are considering how do we further align and collaborate with the dental industry. They are HIPAA covered entities. And so, for instance, the code denials and adjustments, we did within, some of you may be aware of the CAQH index, which tracks through about 3 billion claims, the adoption of the transactions that are used right now, and we hope to expand that into other data exchange mechanisms. We added dental plans into that. We are working with Delta Dental Association, also endemic, and we've been working with the Dental Association actually on writing some articles about EFT and ERA. So dental is an important part of the whole medical piece and something that CORE and CAQH as a whole is working to collaborate with.
Great. Thank you, Gwen. So Joe, go ahead with your comment or your question. I think you're through now. Joe, are you there? I see your hand is raised and I've unmuted your line, but perhaps we can't hear you. Okay. I guess we'll look for other hand raises. If you would like to ask a question or make a comment, the lines are open. Please feel free to raise your hand and we'll unmute your line. But Any other points you Matthew or Gwen wanted to make?
I was just going to say, in addition to Gwen's comment about working with dental, and we have had dental organizations which are in the pipeline to be certified, dental health plans, so certification works for dental health plans as well.
Great, thank you very much.
We did have another question written in about attachments and the pilot that we were talking about. What has been laid out in the pilot is to try, there's several different ways you can do attachments, obviously using the X12 standard. There is the HL7 CCDA, which is the actual attachment piece on the medical record, which really on a longer term basis will absolutely help reduce a lot of the costs here. And then there's entities that are doing simple attachments like PDF and JPEG. So if you do have a process and you're a health plan or a provider that is working with one of many different attachment options, we would love for you to sign up for the pilot. It will be that a tracking of how you changed your systems and what the results are, or actually changing your system if you haven't done it yet, and then tracking the results, which is the best to do a actual study versus the retrospective study, but either one will be accepted. So do contact us. So if you're using the CCDA, you're using JPEG, PDF, you're using maybe the transport for direct to send PDFs, whatever you may be doing as electronic attachments rather than the US mail or fax, which we're not going to be studying, let us know and give us a call.
Thanks so much, Gwen. So it looks like we're out of time. And for those of you that submitted your questions and we did not have a chance to address them today, we will follow up with you. One of our subject matter experts will follow up and close the loop with you on that. I'd like to take some time to thank our speakers and thank you all for taking time out of your busy schedules to join us. And just a reminder, a recording of the session will be available on our website in the next 24 hours. You may now disconnect and have a great rest of your day.